Yeah, obviously, Rob will be with us shortly, but I thought I might, if we frame this up a little bit, between the two of you and Rob, you all obviously had quite different roles going through the COVID experience. Keriana, you were right in the centre of it. You were outside for a while and then back in, and we might ask you to explain some of that. Adrian, you were right at the front line in one sense, but probably a bit further away from some of the centralised model. And then Rob was a bridge between the two. So I'll hand over to each of you to just, I guess, make the key points you want to for a few minutes, and then we'll open it up to the discussion. I'll start with you, Keriana.
Mōrena tātou, ngā mihi nunui, ngā mihi aroha kia koutou, no Ngāti Pāhauera me Ngāti Kahungunu ki te Wairoa hau, ko Keriana Brooking ahau. Kei runga I o rekereke o tō tūranga waiwai is whakatauki from Ngāti Pāhauera. Even though I'm sitting, the whakatauki is, it's on the heels of your feet where you make your stand. In the words of the Carpenters, COVID sometimes seems long ago and oh so far away. But if we look at the latest figures, there are still around 1,300 active cases of COVID in Aotearoa today. Just want to give you a little bit of context about the health system at the time, and a lot of this you'll be familiar with. So 2019 through to 2020, the health system responded to 5 emergency management responses. So there was the Christchurch terrorist attack, there was measles in the Pacific Island, there was Whakaari White Island, and then there was COVID-19. So all of those things had massive impacts on a number of people, but not all at once, and not everywhere in New Zealand. I think the second thing is when COVID arrived globally, there was so much about the science that was not yet understood, and it swept globally and was on the doorstep of New Zealand in quite a quick pace while the science was still being worked through. I worked in the Ministry of Health as a Deputy Director General, and in January of that year, we thought we were pretty amazing just getting the people from Wuhan over to Whangaparoa and finding enough motorhomes for them all to stay in. And we kind of said, wasn't that a great job? And let's be honest, that was step 1.1.1.A of what actually eventuated in Aotearoa in relation to COVID. So I was asked by Ashley in February, and I remember it distinctly. I was leaning up on a wall outside the emergency centre. Some of you have heard this story. Ashley had gone down to Invercargill to watch his sons in the pipe band competition. He'd made a last-minute decision to go, and the only bed he could get was in a backpackers in a shared room. He decided in that weekend that we needed to really go big or go home on how we were doing the setup for COVID, and he rang me and asked me if I would be the DCE COVID. And that's the role that I played from February 2020 to July 2020, and then I left to become the Chief Executive of Hawke's Bay District Health Board. And so it was really interesting for me. I got to see the consequences of decisions made and thought about in the centre, and the impact of that on a region like Hawke's Bay, a place where I still live today. I just want to remind you of some things, and they are things that you will know and have probably just tucked into the back of your mind. You know, it was late February when we have 2020 when we had our first case, and then very quickly we were going through as a country that we were asking people to self-isolate. We started closing the borders. We very quickly introduced alert levels. We went through a whole series of items as a country, and we got ourselves through to June 2020, where we thought, yeah, we'd done pretty good. We were getting this rolling maul of tēnā koutou katoa. There are no cases in New Zealand today. I have likened those 1 p.m. stand-ups to when I used to ring my mother when Coronation Street was on. She used to say, Coronation Street's on, and then she'd hang up. Never ring anyone in New Zealand during those stand-ups. And then we thought, by 8th of June, we'd done a not too bad job, and then on the 11th of August 2020, 4 cases in the community were reported. On the 11th of August 2020 is actually the day that I was welcomed to Hawke's Bay District Health Board. We had Ashley in attendance. I was the only Wahine Māori District Health Board Chief Executive in the 21 years District Health Boards were in existence. So every Māori known to man had turned up to my pōwhiri. We had probably about 400 people there. Dr. Nick Jones, that evening when they announced we were going back into a level 3, rang me in a panic that he thought we'd created a super spreader event, but that was not to be. I think the 3 things I just want to say in closing is, what do I reflect on for next time? And for us in Hawke's Bay, it feels like we are in next time right now. The thing for me about COVID in particular, the reality of the way New Zealanders lived and worked here and overseas was underappreciated, or it was an accepted risk that as a consequence of immediate public policy kicking into gear, people got stuck on both sides of the closed door. And the school base and the social fabric and the message the closed door sent still reverberates today. The second thing is that communities can make it work if they have sufficient resources and good infrastructure. And we saw some amazing examples of how communities in COVID worked really well together. And I think about Matakawa up the top of the East Coast. They were, they treated the public policy as guidance, but they really worked out how to make it work for them. We find ourselves in Hawke's Bay working out how we're doing community resilience with the lack of infrastructure that we're experiencing right now. So there's 2 kind of elements that have to work in sync, and what happens when they get out of sync. And then I think the last thing is that in August 2021, we went back again into Alert Level 4. And did we really learn enough between those 2 years? To lessen the blunt force of public policy on economy and available social licence. And for those Aucklanders in the room, the long, cold spring and summer of 2021 will forever stay in their minds. And what lessons are commonly agreed now that we don't actually need a Royal Commission of Inquiry to point them out? That would be my final comment. Tēnā koutou.
Kia ora, Keriana. Adrian.
Thanks, Matt, and endorse a lot of what Keriana said. I thought I'd just start with a quick quote, and if you excuse the rather clumsy metaphor at the start of this. Like hand sanitizer and a paper cut, COVID-19 exposed the cracks in our health, social, economic, government and political systems. The virus exacerbated pre-existing vulnerabilities, and the pandemic impacted all of us, but its burden was not equally shared. That's the opening line from the independent review into Australia's COVID response, but I think those words are equally relevant to here. And I think it is right and proper to both acknowledge what went well in the early stage of the pandemic response, and Keriana touched on that, but also recognise there are things that we need to learn for next time, and we must do better. And I feel really strongly about this. I think we owe it to our kids and our grandkids that we must not let these things pass from our memory, and they pass very quickly. We write them down, we learn from them and get them done better next time, because this will come again. And so for Auckland Airport, when I was at Auckland Airport, as Matt said, we were obviously a private organisation, but we were at the front line along with our border agencies and airlines for the entire period of COVID. So we had COVID in our business every day from day one. So I remember sitting in Grant Robinson's office with Kelvin Davis, giving them a briefing on what was happening in China in January of 2020, and it cascaded from there. Italy, Iran shut down, China shut down, repatriation, then into the entire border being shut down. So we lived with it every day in our organisation and learnt to adapt quite quickly. And so I think we can all see those early phases of the COVID response as a period of classic crisis management. You know, you're dealing with imperfect information, you're responding quickly, you are trying to marshal resources, and I think those early days we got those things broadly right, and there were some scratchy edges around it. Naturally, it's going to happen. But I think the thing that really sticks with me looking back on it was the sense of stasis that sort of occurred over time. I can recount many times being on calls with people in Wellington, with politicians, with others, where my sense of frustration grew over time as this sense of the things we are sharing with you, it doesn't feel like you're listening, hearing, or responding to in a way that is helping us to continue to be better. And yes, things are always dynamic and changing, but when you can see things occurring which were known months ago are being repeated over and over again, and this increasing separation between, as Keriana touched on, the separation between what was happening in Wellington and what was seeing around the country, particularly in Auckland, I think was disheartening. At the same time, there was a feeling that many of us could help to play a stronger role. And it got to the point where that frustration sort of tripped over into a sense of we have to take some of these actions on our own to get things happening. And I can reflect on many examples, bare experience and resources that we had that were not easily available to Wellington or found to be very hard for the health establishment or the response to do. And I'll just pick up on a couple of those examples. So I think the Park and Ride vaccination site, we ended up setting up the largest vaccination site in New Zealand. We did that through a bit of bloody-mindedness, as well as some incredible health people on the ground who just decided that they were going to lead it and make it happen. We did that with the door-to-door proposal. We gathered together experts from New Zealand and Auckland businesses who had experience in going door-to-door with sales experience and mesh targeting around who was most at risk in the community, and we offered buses up. And we had unique buses, and I say buses in the real sense of these are park and ride buses that are specially built for passengers with luggage, so are open and really suit a vaccination status. And when I rang the health people and said, you know, why aren't we using the buses and going door to door? They said, well, we can't get the buses available because they're all passenger buses. And I said, but we have 6 buses and drivers. They can be deployed tomorrow. And they said, oh, that's great. Well, let's do it. And that happened instantly. We had it available. Right down to the rat tests. And if you remember back, and I'll ask you to remember back to the almost... I really don't understand the difference between what happened on testing, but on rat testing, again, through sheer bloody-mindedness, we gathered together 20-odd, 30-odd New Zealand companies who just said, we will commit to ordering rat tests. I rang the head of EBOS and said, can you go and get us a couple of 100,000 rat tests? He said, yeah, I can have them next week. But we had to have highly committed people in Wellington walk that decision through the Wellington bureaucracy to get that signed off because there was a real resistance to getting those tests into the place. And my argument was always, we are running a business every day with COVID in our business. We need to keep our staff safe. We need to have tools that are available that aren't relying on a 24-hour wait for a PCR result. And so those are just some small vignettes about where I think taking a whole of New Zealand response to these kind of crises is really important. You cannot, I don't believe, manage the scale of a COVID or a pandemic like that through the lens of a narrow lens. That lens needs to keep widening. And classic crisis incident management response tells you, and it's in the documentation, is you must be adaptable, flexible, and maintain the trust and confidence of the community. And I think you can only do that through getting the whole of country response, because the government is not the whole of the country. And I think those responses in the future will be far better. And I'm heartened, and Keriana and I were talking about this in terms of the immediate response to what's happening in the Hawke's Bay, I heard an immediate response to say we need to get business involved in response. And I think that took too long to come about, and I'm sure when Rob gets here, he'll be able to talk to that, given he was at that ape or that intersect between government and business. I think it is a critical point for the future.
Kia ora, thanks, Adrian. And nice segue, because over your shoulder, Rob has arrived. So welcoming Rob Fyfe to the stage. Kia ora. And as we know, Rob, you played a critical role bridging the worlds of government-led response and the business community. We talked a little bit about, Keriana's background, having been inside Wellington, then outside. Adrian really at the front line from January onwards. tell us a little bit about your experience and your points before we get into the questions, which I see some coming through already now.
Yeah, I kind of look back actually 3 years ago now, and I got involved ultimately because I was a protagonist outside government, making quite a bit of noise back in early March 2020 that I thought the government wasn't moving fast enough, and found myself in a conversation with a number of business people and the Prime Minister discussing that very issue. I kind of got nominated as a spokesperson. I think I was the poorest person in the room, a conversation. And at the end of that call, the Prime Minister said, well, how about one of you come down to Wellington and act as a go-between between the government and business as we tackle this challenge. And there's stony silence on the phone call. So I kind of got press-ganged into that role. And I guess for me, I've always tried to stay pretty clear of government, to be honest. And I've kind of felt the further removed you are, the more you can get on and run your business with minimal interference and, I guess, interaction. So I didn't really understand how Wellington worked, and in fact, 2 weeks into being down there, I spent 9 weeks. I went down there 2 days before the first lockdown and spent the lockdown in Wellington. A couple of weeks into it, I rang John Key and I said, John, can you please try and help me understand how you get anything done in this place? And we spent about an hour on the phone, and after an hour I was none the wiser. Which probably summed up a lot of my experience, actually. I relied on people like Keriana to be my navigator at various stages to try and figure out how it all worked. But I think for me, there were many, many learnings that became evident quite early on. And some, I guess, which are more retrospective. And I thought I'd just position those 5 issues kind of up front because I think they'll stimulate quite a bit of conversation. One of the big issues for me that completely blew me away was the degree to which misinformation took hold during the pandemic. I mean, the number of times I had previously very sane friends of mine ring me up expressing all sorts of rumours and beliefs about what was going on around COVID, which were completely untrue and inaccurate. And the momentum with which that gathered steam as the pandemic progressed just caught me completely off guard. And I think the number one issue for me as I look to the future, if we had another of these events, is that information management and how you build genuine, independent, trusted sources of the truth is critical to guiding our way through this. We ended up with an incredibly centralised decision-making infrastructure. Everything was centralised pretty much into the Ministry of Health in Wellington. I think at one point that organisation grew to be several thousand people. You took what was a relatively small policy shop in the Ministry of Health and turned it into this all-seeing, all-controlling, all-commanding organisation that ran both policy, critical decision-making, operations, and actually in the process became a massive bottleneck for decision-making and actually excluded a lot of people from that decision-making process because there was just so much going on. I think also, and I heard Adrian touching on it, because of that centralised decision-making process, we ultimately lacked agility. We did a tremendous job, I think, early on. I mean, COVID is a classic story, right? It had a beginning, a middle and an end. I think we did the beginning really well. We're in the end now, which is living with COVID, which was ultimately probably predictable where we would end up. But the middle, the transition between the beginning and the end, really became pretty contentious. And ultimately, we lost a lot of. Is that better? Right, awesome. And ultimately, through that process of lack of agility, the virus evolved, and we became trapped in a strategy that I guess progressively became less and less fit for purpose. Two other points I just wanted to make. Let me just grab my notes here. I guess the other issue, and I've experienced this myself, being involved in managing crises, is we became very, very consumed by the daily operational vortex of the crisis. Case numbers, deaths, vaccine numbers, the wait list in MIQ, everyone right up to the very, very highest levels of government was all fixated on the daily operational issues. And as a consequence, the effort that was going into the longer term planning and the strategy and where the off-ramp was out of our elimination strategy and so on, we probably were allocating far less resource to that forward planning than we were to just managing the day-to-day operations. And then finally, the point, we pride ourselves, I think, as a nation on being very kind of can-do. And I think in COVID we became very can't-do ultimately, and we were constantly finding reasons not to do things. Our elimination strategy made us inherently very, very risk-averse, because the idea was we had to trap every possible vector of the virus coming in to protect the community, to maintain this position of elimination. That forced us to become so risk-averse that, as I say, everything became a reason why we shouldn't do things rather than looking for ways to get things done. So I just sort of position up front, they were my kind of five, as I looked to the question that was posed this panel of saying, what can we learn for a future such event? I think there's a lot of discovery that needs to happen in those 5 areas where we could do a lot better next time around.
Kia ora, thanks Rob, and thanks. I'm seeing some very interesting questions coming through. I'll get to the one on liberal democracy in one moment. I might start here actually with you, Rob, to keep going. One of the big themes that came out of that discussion was about evolution of the response. Can you talk to us about, it's just what you touched on in the end, how did it evolve or didn't it evolve? And for those of us, most in this room, that were a lot further removed, what part of the organisation was working on the response rather than in the response? Was there a constant sense of review of how it was evolving?
If I look at the various layers, there was a lot of pushing from outside the Ministry of Health to constantly look at evolving our approach. And that was coming from the Prime Minister and Cabinet, it was coming from the business community, it was coming from the Māori community in iwi, it was coming from the Pacific Island community. We became ultimately, and this is my view, and as I say, this is partly a retrospective, it wasn't always visible at the time, but we became a prisoner to our elimination strategy. What ostensibly happened, we were pursuing this strategy, we were one of the very few countries in the world that was pursuing that strategy, and I think we convinced ourselves that a lot of the learnings internationally weren't relevant to us because they weren't pursuing the same strategy we were pursuing, so it wasn't easy to directly transfer and translate those learnings and those insights. I mean, rat test was a classic example. You know, the view was we needed a testing regime that would pick up every single instance of the virus. Rat tests weren't as accurate, therefore they weren't really relevant to an elimination strategy because you couldn't afford any single vector for the virus to come in. So we shut down a lot of sources of potential innovation and evolution because we defined our approach to dealing with the virus as relatively novel. Therefore, we had to develop our own insights and our own solutions. So we became very introspective as a country, certainly within the ministry, in terms of looking at how we could adapt. And I think ultimately, you know, that was a limitation for us. You know, I look at saliva testing. It was proven in an operation kind of 18 months before we were allowed to use it in New Zealand, and then we hamstrung the capability. Rat testing was the same. A number of the decisions at the border were the same, and you know, Adrian can talk to that very eloquently. I think our mindset became one of, you know, we have to chart our own path through this. And if I look from a business perspective, you know, all our best innovations and our learnings always come from looking at what others are doing and trying to import that into our organisation, and we lost that opportunity somehow in this process.
Yeah, great.
Can I just build on that, because I think that devolution point is important, but that sort of sense of the mortgage on ideas coming from the centre was really, you know, showed up in many places, but I remember one example where I was briefing a very senior minister about the work we were doing across actually government and private sector, led by customs and MOT. And so what we were looking at was the future border model in a risk-adjusted way, reflecting New Zealand's elimination strategy. I remember sitting in with that minister and giving the briefing and saying, look, we've got a great model here, you know, cross-government and business. And his comment to me was, yeah, we need to go and think about that, or I need to go and think about that. And it really struck me, which is, and I said to him, actually, you don't need to worry about it. Give us the problem. We'll go and work on it and come back to you as the decision maker with a proposal, and you can decide. But you don't need to work it out. So I think that sort of sense of centralisation, which was a combination, I think, of risk and this sort of sense of New Zealand's elimination strategy was so unique that the ideas could only come from one source, I think did limit us. And it stopped us sort of dealing in a sensible way with some of the things I think could have been dealt with in the 21 year. That took much longer than it should have to resolve.
It's really interesting. For those, if anybody's got a question, just please raise your hand, but do wait for the microphone to come to you, just for those on the live stream. So if anybody has got a question, please raise, and I'll keep going for now. Staying with you, Adrian, because obviously you're at the front door of New Zealand, and so inherently connected to responses all around the world. What were you seeing happening on the international scene that you thought we should have learned from earlier? Or maybe examples where we did, and we did adopt those things.
Well, I think, and Rob touched on this, testing was a really obvious one. And I won't go over that too much again, but that was a clear example. I think there were other issues around risk-based approach to managing the movement of people from different destinations or origin points. And the sort of sense that there was no other answer than the eliminate and put through MIQ. And I think, so there were plenty of examples like that, and that frustrated, I think, a lot. And it also had very high personal costs, I think. I think we could have, and Kieran probably know more about this than me, but I think we could have moderated or modulated our MIQ response in a different way based on a more risk-adjusted approach, which would have lessened the social cost of some of those measures much earlier than it otherwise had. And so I think picking the best, as Rob said, from around the world and applying it to our local context, I think is the right thing to do. And it was a little bit like wading through treacle to get people to listen, to reflect on and sort of say, yes, that sounds like a great idea, let's go and work on it. But we were working it by asking the private sector as well as the public sector to work together on what those answers might be. That felt like real resistance.
I'll just jump in there. A perfect contrast for me is in the March 2020 Alert Level 4, I left the Ministry of Health building the day we went into lockdown. I had an apartment in Hill Street, so 2 blocks away, and I walked in, it was dark, there were no cars, and there were no other people on the street. So I was going up Hill Street, and a homeless person popped out of the pathway from the back of Parliament onto Hill Street, and we both gave each other a fright, because we were the only 2 people, it felt like, in Thorndon on the street at that time. And she said, "What's happening?" And I said, "What's up, love?" She goes, "What's happening?" I said, "We're in lockdown." "About what?" And so we had a wee chat, and I said to her, "Have you got somewhere to go tonight?" She said, "Yeah, I'm sorted. She said, "It's a bit weird, not having anybody around." I said, "Yeah, that's true. August the 12th, I wake up in Hawke's Bay, and I drive myself from Hawke's Bay to Hastings Hospital, and we have determined in Hawke's Bay that everybody's an essential worker, because we've got so much going on in Hawke's Bay that means our economy needs to thrive, that I probably only saw 20% less people on the road than I did the day before. So we had worked through what it meant in Hawke's Bay to live within the parameters of a lockdown, but make sure that we could still grow grapes and pick apples.
That's really interesting. Keriana, I'm going to stay with you because really interesting question now from the health background. In retrospect, do you think due consideration was given to some of the health trade-offs? So obviously there's economic, there's social, but impact of delaying elective surgeries, treatments, impact on mental health. And even can you give us a picture into some of those discussions that were happening around this? Obviously it would have been discussed.
Yeah, so I think it was clear to everybody that there was a primacy around the public health policy. There was kind of layering within the health policy, so public health policy, what that meant for us to respond to a public health matter. And then based on a number of the incredibly alarming stories we saw in other parts of the world around the health response to people who had COVID, it was quite concerning about our ability as a health system to be able to push that many people through primary care, push that many people through hospitals. And so that was the second layer of, if you remember at the start, everyone was worried, and we still counted how many ventilators we had in New Zealand and how many ICU beds. Everyone talked about the tip, but we really need to talk about the base equally as much. And there was a, and then the next layer then was what were we missing out on in preventative care? Because equally there were there was planned care that could be done, hips and knees, but there are women who haven't had cervical smears, there are children that haven't had immunisations. So I get that the planned care is important to a lot of New Zealanders, and it affects a lot of whānau, but there's a very massive base of preventative healthcare that also we will spend, I think, a generation catching up on. What I would say is those things were considered, but public health policy took primacy. And if I just speak with my former Hawke's Bay District Health Board hat on, in winter 2021, we had a respiratory presentation to hospital winter like we'd never seen before. And so it actually wasn't COVID that was putting pressure on our hospital. We are a hospital that was built for 90,000 people of Hawke's Bay, and we now have 180,000 people. We had an emergency department that was built for 60 people to be in it, and we see 180 people a day. So for us, we didn't even get to think about COVID because there were other things that were in front of us. So I think that people accepted that there was only so much could be managed through the pipe and we were going to have to live with the consequences of that. And I think for everybody in this room, they will know that the consequences of that fall completely differently across different demographics of New Zealand, and it will be poor people and it will be brown people that will be facing the consequences of that for far longer than everybody else.
I'll just check. No one in the room. All right, well, I've got a lot, so we'll keep going. Rob, you said something really interesting earlier about information management. You know, people that seemed solid suddenly felt like they'd gone down a conspiracy hole and so on. At different times, the COVID response was criticised for maybe over-managing information and so on. What do you think could have been better in that space? What were the gaps? What did we get right? And what could have been better? Because many sectors of the world talk about that as actually one of the strongest parts of the New Zealand response relative to how it played out elsewhere.
I think this issue falls into the category of this lack of adaptation and agility. I think we did really well on communication early on. I think the Prime Minister and Ashley built real trust and confidence through that probably 2020 period, and I mean, evidenced by the election result, right? You know, as a population were very supportive of what the government was doing, the direction we were heading in. I think as soon as we got into the vaccine phase, there were a whole bunch of unexpected issues emerged. You know, we clearly, there was a lot of criticism because the vaccine was perceived to be late arriving in New Zealand. There were a lot of issues around the process of and the information around the vaccine and so on. And we were under pressure to get it rolled out because vaccine was seen as a critical foundation stone to being able to move to a different state, I guess. And I think it's when we got into that phase and there started to be a few chinks in the armour, and there were certain segments of the population that believed the government wasn't being full and frank, or the Prime Minister wasn't, or Ashley wasn't, about vaccine and the consequences of it and the justification for why it seemed to be arriving late and so on. And I think it was from that stage onwards that we saw trust start to ebb away a little bit, and with trust is connected to social licence and so on, and you just saw a few things fraying at the seams, and then ultimately I think there was a fatigue element that set in as well. When you got to August 2021 and you had the Delta outbreak and the Auckland lockdown, I think that really started to test people's, I guess, commitment again and trust in the government. And it all started unravelling pretty quickly looking forward from there. So if you go back and say, well, what would you do differently? It's a hard question. I mean, you know, there's clearly no substitute for absolute honesty and truthfulness and transparency. And whilst I don't think there was ever any dishonesty, I think you've got to be really careful when you're a communicator that you don't try and become too clever in terms of how you position your arguments and position your language. And I think, and this is not directed at any individual, but I think collectively there was too much message management rather than thinking, how do we get really, really precise, clear, accurate, confident sound bites out that people can understand. And I think the spin doctors progressively got involved, and that started to undermine trust. It does make me wonder whether through a process like this you need some independent authority that sits outside of the decision making that can validate the kind of the source of the truth, if you like, that's not politicised, that's not involved in the core decision making where they're having to justify their own decisions and so on, which you could say is true of the Ministry of Health. You look at the Prime Minister, ultimately it has to become politicised, right, through that political lens. And I wonder whether you can have an independent authority that runs alongside and gives people reassurance of the messaging that is making its way through. Because I think this issue is only going to get bigger. I mean, you look at real-time global social media. I mean, TikTok trends die. They arrive and they die in the space of a couple of days. You know, it's and so we've never experienced a crisis with that level of real-time social media before, and certainly not an extended one like this pandemic. I'm going to put a pin in that. I'm going to come back to that notion of the independent side, because I think there are some questions here about looking forward, preparing. I'm just going to check here. Obviously, we're looking at things that maybe were gaps. That's appropriate because we're trying to learn. Also, what went well? What should we be most proud of? What are the things that we need to ensure that we do again or build upon for the next crisis, be it a pandemic or something else?
I was just building on, on what Rob said. I think if you look around the world, I think the research is starting to suggest those countries that did their best started with strong trust in institutions. And I think we have that in New Zealand. We're probably in a better position than other countries. But I think it has been eroded through what we saw in COVID. So I think there is a real need to look at our system of government, system of engagement with the community, and how we work with community to make sure that trust is rebuilt. So some of the things that Rob mentioned I think are critical. I'd add to that, how do you get transparency and trust is contestability of ideas. I think there was a sense of closed that meant that different ideas were not welcome and information was not open. So we several times over the course of the pandemic asked for access to the models that were guiding decision making, the metrics, the outcomes, and in fact publicly called 5 chairs of major New Zealand companies called for, tell us what you're solving for, yet it was not shared. And so I think that lack of contestability or openness to different views, I think, does erode trust, both with individual citizens but also other organisations that work with government. So I think rebuilding trust in institutions, I think, will be one of the most important things. And then Rob mentioned a few other things, a CDC-style model, surveillance for the future. I mean, there is no question. And we have, and I keep saying this for years, we have animal biosecurity at the border and have had for decades. And we're one of the few countries in the world that already have that. So we know how to do this. Human health security at the border is something we have to have. And there are different ways you can do it, but it can't be ignorant of the realities of running a border itself. So it can't be derived in Wellington and then cooked up and delivered. It must be built with airlines, border agencies, airports and others. So trust in institutions, I think, and looking at the ways that we manage for the future pandemic through building the institutions that we need for the future will be important.
I actually thought we did, and I referenced this earlier, I thought we did a really good job of the first phase. The decisions that we made, and you have, when you remember back then, there was so much we didn't know. So we were having to make decisions on very, very limited information. And I thought we did a really good job through the first phase. And it's fascinating, Keriana talked about, we went into lockdown, most of Wellington went home. It's amazing how well that place works when there's no one there. I mean, quite seriously, that's right. Keriana didn't feed me all these lines, just to say, because she can't say them. But the reality is, when all the bureaucracy was cleared out of the way and there was a very, very small number of people making decisions, it did actually work really, really well. And a lot of what we're talking about is when these large kind of bureaucratic, monolithic things re-establish themselves and the Ministry of Health tenfold the size that it previously had been, then of course everything slowed down. I mean, and it's just human nature. You know, if you have 10 people in a room trying to make a decision, it'll take twice as long as you have 5 people in the room. It probably takes 4 times as long, actually. So one of the learnings for me is to say it worked so well, and we were making really, really good decisions when we had a very, very limited number of people involved. How do you protect that as you move forward and try and constrain the bureaucracy from re-establishing itself and slowing the whole machine back down again?
Yeah, I mean, Rob probably wouldn't, but I would have described my role in the early days with Rob as the rose amongst the thorns, because there was Rob, myself, Mike Bush, Brendan Boyle. There was a small group of people in the Operations Command Centre who met every day, and I came and was a translator and a navigator of what was going on in the ministry, and we would land sensible forward movement in a way that really made sense. I mean, I think for me the things that went well, and then I'm not sure if we adapted as well as we could. At some stage, we needed to convert the SIM structure, the emergency management approach response, to what happens when the response lasts 2 years. And how do you evolve that? Because a lot of that was quite well understood and well protected, but as Rob says, as you add more layers and people, you really lose, I suppose, the ability to make decisions as quickly as you can. Adrian and I were talking before this about the appointment of a public sector, private sector task force to manage the Cyclone Gabrielle response from the start, I think is also a lesson well learnt. And I think that's a lesson that is folding into each region. You know, when I talk about Hawke's Bay, we've got 4 district councils, we've got a regional council, we've got 14 post-treaty settlement groups, we've got large primary industry. It's the beauty of democracy and the Games of Thrones, all at the same time. And so you've got to be able to make sure that everybody is there, because these are big tasks to tackle. So I think that is something we need to work on. I think the last thing, which I think was a beautiful thing, and again I'll use the Hawke's Bay example, our Māori providers in our tai whenua were the lead for the whole population for our care in the community and for our vaccination program. You know, in Hawke's Bay we can be a little bit Plymouth Rock, and sometimes there are people who would have not even have known that Māori providers existed, and yet everybody's experience was as positive as it could be. And I think it was a real measure of what's good for Māori is good for everybody. And COVID allowed that opportunity to shine. And so I think that's an incredibly positive thing that came out of our experience of the tail of COVID.
Thank you. And I've just got a question from the floor here, and we've got about 6 minutes or so, and then we'll go into close. Please.
Kia ora, Josie Pagani here. Great discussion, guys. Thank you. I just want to ask, what do you think, do you have any confidence that the Royal Commission will address any of the issues that you've raised?
It's an interesting question. I'm really hopeful that it does. I think the Royal Commission is critical. I mean, you look, so much of our response was developed on the fly. It wasn't predetermined, and already, you know, the key leaders that have all that learning in their heads. Ashley's gone to a different role. The Prime Minister's no longer in her role. None of the 3 of us are in our roles. You know, the world moves on really, really quickly. So I think the Royal Commission is critical to capture the learnings. I think the chair of that commission coming from offshore will be a really good perspective from the outside in. So I think that independence is really valuable. and I think it's absolutely critical. We did get some things right, and it's the nature of the session kind of is designed to look for improvement opportunities. We got a lot right, but there's a lot we could do so much better. And I think actually next time round, it'll be even tougher. I mean, this misinformation issue, I think, is one of the biggest issues facing our generation, and is going to keep growing.
I'd certainly like to see the terms of reference broadened. I think they are too narrow, and I think when you've got an event like this, it affects almost all parts of our country, society, culture, economy. So I think it's too narrow. So I'd like to hope maybe the new Prime Minister might be willing to open that up a little bit more. I also, this is not a comment on Tony Blakely, but I would have preferred someone a bit more distant from the New Zealand response chairing it. I think it's a little bit too close to home. We engaged with Tony on a few things throughout the pandemic response from our point of view, and I know he was involved in other things. So I think distant sort of reflection on what we did, pick up both the good and the things that we work on would be great, but it is what it is. But a broader reference I think would be great.
I think the broader reference will potentially get forced, because as soon as you open the lines of inquiry, people bring whatever it is that they want to bring to the table. And as a former public servant, I politely say the best inquiries always do.
All right, I'm going to go to the closing question. This is with the goal of learning, so one that's come through. If you were designing a pandemic response agency, what personnel do you think its board and management need? How do we set ourselves up better for the next one? And we'll just go quick fire through the team.
I think it needs to be probably a little bit more United Colours of Benetton, which is my point about we need to be making sure that we've got private, we've got public, we've got people that really understand responses, we've got Māori, and that we think about that purposefully from the start, and not make it look like it's something we thought about later or were pushed to think about after we went live.
Thank you.
I'd simply like to apply the standard crisis management response, and it's been touched on by both these guys as well, which is in the way we ran at the airport, and I'm sure it's the same as in New Zealand, which is you have your immediate response team, you have your recovery team who look ahead to how do we get out the back of this, and then you have your strategy team who look very long term. And all of those have to operate at the same time. And then in doing so, you then draw on the whole of the country, all the expertise, all the knowledge, and are open and agile in how you respond. I think that would, and that's an evolution of what we did do, but I think that would help make the next time better. And we write it down. We must write down what we learned.
Thank you.
There's a couple of key principles for me around how you go about designing a future pandemic response. The first is that all your best knowledge is always out on the front lines, right? So you have to figure out how you can have distributed access to new insights that are occurring, whether that's from business, as I say, different community groups, from Māori and so on. So having those insights able to be absorbed by the decision makers is absolutely key, number one. Second for me is open-mindedness. One of the fascinating things about this pandemic, things that I believed a month in were often proven to be no longer true 3 months in or 6 months in. You have to be able to walk away from absolute truths that you believe and accept new realities as they emerge. It's really easy to get trapped into a mindset of defending a previously held belief when it's no longer true. And I think that was really evident. So you need a principle of open-mindedness. You need a principle of being able to access and source insights globally from the best practice. We had countries that were experiencing things well ahead of us because they were pursuing different strategies and we weren't adapting their learnings. And then the third piece of me, so as I say, you need this independence and to be able to build confidence in what is the truth, transparency and honesty as you move. And so I think the CDC and the leadership there was a global role model that we could learn from and we could adapt here as well.
Thank you. Look, we're at time, so I'll call it for this session. There were a lot of questions that came through that we didn't get to. That's those happen in the foyer. Some of them are probably best expressed on a smaller stage as well. But Keriana, Adrian, Rob, thank you so much for this. I know that COVID for some, as you said, seems a long time ago, but we're still living with so many of the other impacts, and we don't know what is around the corner, and some of these things. In fact, we're right in the middle of when we brought in the definition of the responses we need. So we all really appreciate it, and we'll put our hands together. Thank you.